evening and welcome here to PBS 39. My name is Sandy Thompson and I'm the host here this evening of Life Ahead. We always have interesting shows on this Wednesday night with our potential for live call-in, so keep that in mind. And our topic this evening is all the buzz right now. We're going to be talking about annual enrollment for Medicare. We're going to talk about health insurance. You probably have questions about that. And we have, obviously, an expert in the field. If you were watching, he was here with us last week when we started this discussion about health insurance. Please welcome with me Greg McDonald. It's so nice to have you with us again, Greg.
Oh, wonderful to be back. Thanks.
And we talked a half an hour last week, but we still didn't get to cover everything.
Oh, no, we just hit a little bit of the basics.
We did. And I do want to remind you that this is your show as well. So I'll be asking Greg some questions, but if you have any questions, any concerns, now's the time to get some complimentary advice, right?
Right.
You're not going to send invoices to them.
I promise not to. Promise not to.
There you go. There you go. So get your phone ready. The number is 969-2720. Logan is directing tonight, and he will be showing you that number periodically here in the next half hour. Well, let's start, Greg, by reminding everybody that we are in annual enrollment until December 7th.
Correct.
To have the opportunity to make changes. Can you explain to people what, maybe somebody's new at this and they just, started with Medicare or buying Advantage plans or supplements. What does annual enrollment mean?
It's for people who have a Medicare Advantage or a Medicare drug plan. Mm-hmm. They have an 8-week period here at the end of the year to change plans. So this is what it's all about.
All right. Now, why would people want to change plans, Greg?
Because the plans they have probably changed in some way or another, because every year the Advantage plans and the drug plans will change a little bit internally. So that's why it's important to always review the plan that you have. And if you're not seeing things, your drugs in there, your doctors might not be in there, the co-pays, the premiums might have changed, it makes sense to see what else is available and see if something else is a better fit.
And you recommend people really do this every year at
every
this
year.
time?
Yes.
All right. Now, for example, people have probably gotten already in the mail, or maybe you have looked for this handbook, Medicare and You for 2016. If you have not, in just a few minutes, we're going to give you a website address and a phone number where you can try to get one of these. Now, also, if you have an Advantage plan, you probably have gotten a lot of information already. Greg mentioned that you want to make sure that there aren't any changes in your plan. This is a copy of Annual Notices of Changes for 2016. You're going to have covered drugs, pamphlet as well, and your evidence of coverage. All right, Greg, why do I can't read all this.
You don't find that interesting?
Good late night reading.
Good late night reading. If you ever have insomnia, this is great.
It'll put you to sleep.
It will do it.
Sure.
It will do it.
But what's the most important thing I need to get out of
Usually
this?
in the annual, right at the beginning, you'll see changes.
Okay, annual notice of changes.
Annual notice of change. And generally right at the beginning, they'll give you a summary of all the little things that are new for the upcoming year.
And I need to look at this because?
Because there might have been a significant change.
Okay.
We don't know. For example, I dealt with a gentleman this week who had a plan, or has a plan, and they have a transdermal patch for Alzheimer's. Okay. Currently paying $35 a month for that prescription. Everything else is pretty much the same, except for next year, that patch is going to be $147.
Whoa.
So a little bit of a change there.
That's kind of a big deal.
Yeah, it is a big deal, and he was like, whoa, I didn't know that. That's why you look at these changes.
Also, one of the supplements was the list of covered drugs, so that
right,
would
and
be
that can
an
change
example.
exactly.
Yeah,
exactly.
That would be an example. So, from what I understand that you were telling me last week, you were a good teacher. I went home with lots of new information. if you take a prescription regularly, and it's a costly one, you want to make sure that your insurance is still covering that. So your supplement of covered drugs should be able to answer that question, because somebody could one year maybe only be paying I don't know what, for example, $15 for their copay on it, and maybe that drug has moved to a different tier,
Right.
or the insurance company has changed, and it could go to $115.
Well, the thing that's most important is to make sure they're still on the formulary, because older drugs, particularly people will say, well, I've been taking this drug for years.
Yeah.
Well, if it's a really old drug, sometimes they just drop them because there's alternatives on the market now.
So they won't even cover it
They won't
at
even
all.
cover it. You can still buy it, but you're going to pay full price.
What about like mail order drugs? Would there be differences in that too? I mean, if you
Can be.
Okay.
There can be. The companies, particularly the big ones, and when I say the big ones, United Healthcare, Anthem, Humana, are offering some very good deals on generic mail order. You can often get these drugs for free if you use the mail order service. The brands, not so much. They'll give you a little bit of a break. Sometimes they won't give you a break at all. So you really need to look at them. Sometimes a company will tier a brand. They might take it and put it in a generic category. They might put it in a non-preferred category, which means the cost goes up. So it does make a difference.
So, as the patient or consumer, then it's my responsibility to look at this information and find out what tier my drug is, or
Right. So you don't have any surprises.
right. And then if maybe it was an old one, like you said, and they just dropped it completely and aren't going to cover it, then I need to pay attention and know that, so I can go to my doctor and say, I need a generic for what you used to give me. Something like that?
Could be. Or what's an option for this drug that I was taking?
Okay.
Okay, so the companies are required to carry drugs for each category of medical conditions. Okay, so they have to have drugs in the category to treat that particular symptom. It just might not be the one you're used to taking, or the one that works best for you.
What about providers? Does that change, and are we notified of that change?
Not necessarily notified that that has changed. So it is, again, incumbent on you to check to see if your provider is still in network.
Which would be one of these supplements that you get,
Well,
maybe.
Really, the best place to go to see if your provider is still in the network is the company's website. And they will always have, find a doctor, find a provider. Go there and check it out.
Okay, so for example, I mean, these pamphlets are from Anthem Blue Cross Blue Shield, so I would go to their website.
Go to the website, usually on the front page that you get there, you'll find a doctor.
Okay.
And they'll ask you what kind of plan you have, what zip code you are in, and you just click on that, just different questions. And then they will ask, okay, who's the name of the provider? Type it in there and hit search. This is critical if you're in an HMO plan, because HMOs, you need to have a primary care physician, because everything typically runs through that person. And if that person's out of network, then you've got a problem. So you need to check every year.
Okay. All right. Now, I hope you're all listening to Greg and going to obey what he says. Greg, I mentioned just a minute ago that we would show you a website and a phone number where you can get your Medicare book if you haven't yet, or get some questions answered. And we're going to show you that on the screen right now. Alan is back in the control room and is so good about making sure we have information like this. Medicare.gov or 1-800-MEDICARE. Now, if I have questions about coverage for Medicare, will they answer those on the phone, or is there more information on the website?
They'll generally refer you to the website.
Okay.
That would be the easiest way to go to get information.
Will they show me on the site a comparison, for example, between the different plans like United Health, whatever, Blue Cross Blue Shield,
Yes.
Humana, so I can see what fits best for me?
Yes, they will.
Okay. We have a phone call.
Good.
And thank you so much for giving us a call, Mike. Can you tell us what your question is, Mike?
Well, yes, unfortunately, I take a lot of medication,
I'm sorry.
and two of my medicines, I've got parts A and B and D, cheer groups, and two of my medicines went up from $7 a month to $50 and $57
Whoa,
a month.
that's significant.
I'm sorry, ma'am, I can't hear you.
Oh, okay, okay. How would you advise him? Is that what you're asking, Mike?
Yes,
Okay.
I'm extremely frustrated because my money is tight.
Yeah. And that's a big difference from what you paid last year to what they're asking. How could you advise Mike?
Well, Mike, you need to really do some checking as to how your plan stacks up to other plans in the market, because we have multiple drug plans and we have multiple advantage plans. I really suggest that you get with someone who can advise you and look on the Medicare.gov's website or on the plan websites to see which plan might best align with your drug list, because it can make a significant difference. And you'll see that. In fact, the Medicare.gov does a great job of comparing these plans, so you are able to get on there and see, okay, here's the plan that I have now, what the price is. What's the price what the other companies have? And also, are all the drugs on the formulary? So go there or get some advice with someone who can help you look through the options available to you, because there may be a way you can bring your cost back down.
Greg, obviously, you know, if you're not computer savvy or it's just too confusing for you to try to get this information online, then the best thing would be to go to an insurance expert, a health insurance expert like Greg, to help you sort this out. Is that an expensive process to go get consultation?
No. Agents cannot charge a fee for their service.
Advising.
For advising. They cannot. Agents are compensated when a plan is sold.
Okay.
Okay. So if any agent comes to you and say, "Oh, I charge a consultation fee," show them the door. Show them the door. And people have done this in the past.
Really?
And it is illegal for them to do this.
Okay.
So they can lose their license for doing it. That doesn't mean some of them don't. But yeah, if anybody wants to charge you for it, say so long.
So, Greg, you know, if I were to come to you, then there's no charge for you to give me advice and help me pick out rights for me.
No insurance agent can charge you for that.
All right, that is really good to know, and I hope that helped you, Mike. Doug is on the phone as well tonight, and he has a question. Thank you so much, Doug, by the way, for calling. What is your question for Greg McDonald?
Good evening, folks.
Hi.
This is my question. My wife and I are 71. When we originally became eligible for Medicare, our financial and health situation directed us to a Medicare Advantage plan, and we've been on that plan for about 3 years. Time and circumstances, change. Would we be able to consider returning or going to original Medicare and a supplemental plan? And if so, are there any risk associated with making that change?
You know what I like is that you're a very knowledgeable consumer. He knows what he's talking about. Okay,
Right.
How would you advise Doug then?
Doug, you have a perfect opportunity to go back to original Medicare and pick up a supplement. You can do that at any time. Well, I should say, you can do this during the annual enrollment period since you have an advantage
From now
plan.
till December 7th.
Till December
Okay.
7th. What you will have to do, though, is you will have to answer health questions, because Medicare supplements do ask health questions when you go back to them after a year's worth of time. Check the different companies, because some of them ask easier questions. Okay, it's easier to get qualified with some than others. So if you have some health issues, don't let that deter you. Do some checking. You should be able to find something.
Okay, thank you so much. And Doug, good luck to you. And again, his name is Greg McDonald, if you want to get in touch with him to get more information later or another day. Arlene is just called in as well, and Arlene prefers not to talk live on the air, which is fine. You don't have to. We do have phone service in the control room right now. James is answering our phone calls, and he will type up your question and get it out to the studio to me on the teleprompter. So I'm going to read you Arlene's question. Arlene says, could you address Obamacare? I knew somebody would ask about that. She wants to look into it, but it is so confusing. Can you break down her choices? I'm sure you have Obamacare questions every day.
Well, I do. And it is confusing. Now, what we don't know right now is how exactly the plans look like for 2016. That will be announced November 1st. And we'll be able to look at the different companies, the different plans that are available. You would have until December 15th to enroll in a plan that begins on January 1st. What I suggest, there's plenty of help out there to look at the different plans. There's healthcare.gov, and you can look at all the different plans that are available. There are navigators out there, there are agents, there are plenty of people that can help advise you which plan is going to be better. But here's the thing to keep in mind. The plans that we have available to us tend to be HMOs, which means you have to stay within their network. You want to make sure that your doctors, your providers, whoever they may be, are in the network of the company that you choose. And that's important because we have some companies that work Parkview, some will go with Lutheran, some do both. You just need to check that out. And my advice is just to find an agent or someone who is working with this to help you find a plan that works for you.
You're just so articulate in trying to help people, and I appreciate that, and I think that they do as well. In fact, Tom has just called in. Tom, thank you so much for watching Life Ahead. What is your question for Greg tonight?
Thanks for taking my call.
Glad to.
I'll turn 65 in February of 16. I've been receiving all the Medicare information, but I'm actively a full-time employee with full-time medical coverage being provided by my employer. Do I still apply for Medicare, and what are my options?
Thank you, Tom. And I imagine a lot of people are in that situation where they're eligible now for Social Security, and maybe they want to go ahead and get that, but they still are working and still have health insurance provided by their employer. So how do you advise Tom?
Tom, your employer actually can continue to insure you. You want to stay with that as long as you want, okay? Pick up Medicare Part A. Doesn't cost you anything. That deals with hospitalization. Deny Part B as in boy, okay? Your employer plan meets that need. That will save you from having to pay the Part B premium. When you are ready to retire, then sign up for Part B. And at that point, go on a Medicare plan. This way it'll save you some money. You can ignore all the solicitations that you're getting right now, and I know there's bundles of them, but no, you can stay with your employer's plan as long as you like.
And that's something that a lot of people don't really understand. I mean, they don't have to get Medicare, all of Medicare, if they're getting good health insurance.
No.
In fact, it's probably, in most cases, the better idea if you're working to stay with your company's insurance policy.
If you like the plan.
Yeah,
absolutely.
well, true.
If you like the plan.
Except for he should get Part A, just Part A.
Get it Part A. It doesn't cost anything, and it actually acts as a secondary to the current insurance plan.
Okay.
But don't get Part B, because that would cost you money. You don't need it at this point.
Speaking of Part B, I know that there are some controversies and confusions right now about that. Could you explain that to our audience tonight?
Yeah, there's a lot of confusion or speculation on what's going to happen with Part B premiums and deductibles based upon what the cost of living is going to impact on Social Security. Well, for those people who are on Social Security, getting that right now, and on our Medicare, you will not have a premium increase, okay? That will be locked in place until such time that your Social Security income actually increases. At that point, then you could have a bump. If you have a supplement plan that is not a Plan F or a Plan C, the Part B deductible can go up, and so that could impact you. But if you have an Advantage plan, there really won't be any impact at all because they don't go with the Part B deductible. So we don't know what the numbers are going to be yet. They will be announced soon, and we'll be able to see that. But a lot of people are concerned how it's going to impact them, and they don't need to be. For those who are just coming into Medicare, that Part B premium can be higher than what we're currently paying. But rest assured, once inflation ticks up again and they're able to increase Social Security income, then those premiums will come back down to what everybody else is.
Okay, so don't panic at this
Don't
point.
panic.
Okay.
Don't panic.
You know, we have gotten another phone call tonight, this one from Darlene, and I'm going to be reading that question to Greg as well. And this, you know, is a type of topic that may appeal or may be similar for a lot of you. Darlene says she takes care of her 93-year-old grandmother. She moved to Indiana from another state, and she never messed with her insurance, but can she still now carry the same insurance from another state?
Depends.
Okay.
It depends, because if it is a Medicare supplement, yes, you don't have to change that at all. It will travel with her. However, if she'd had a Medicare Advantage plan, yes, you do need to change it, because those are region specific. And if, for example, she came from Arizona, that plan isn't going to work in Indiana, so she does need to make a change.
Okay, so she should contact the Advantage plan.
No, she doesn't need to contact the Advantage plan. All she needs to do is just, if it's an Advantage plan, pick another one. It'll
Okay.
automatically kick out the one that's there, and she'll be good to go for January.
Where should she go to do that?
She can do it an agent. Go to an
Okay.
agent and talk with someone who can advise her.
Okay, okay. And you mentioned in a conversation just a few minutes ago, Plan F. And I did have somebody after last week's show say that they'd never heard of Plan F that Greg and I were speaking about. Can you talk about that, address Plan F again?
Well, Plan F is a Medicare supplement plan, and it is the most popular plan out there. If a person has original Medicare, a Plan F, and they have a Medicare covered service, they won't pay for any services at all. They can go
Okay.
anywhere they want. So there's a lot of advantages to it.
Okay, all right. Now, what is the most common question, Greg, that people ask you when they come to see you for consultation or insurance questions?
The most common
The most
question.
common question.
You've been asking a lot of those common questions, so I think we've pretty much handled those. They're interested in what plan changes are going to be happening, anything new that's coming up. And I mentioned this last week, and I want to mention it again. A big thing that's happening right now are for people who are on a Medicare Advantage plan called Care Improvement Plus. That is a plan that is going to exit the market this year. And so anyone that has that plan needs to make another selection. And they can go to another Advantage plan, or if they ever considered a Medicare supplement, this is your golden ticket into a supplement without having to answer health questions. In fact, I enrolled a couple people today who had just that situation where they had Care Improvement Plus. They had multiple health issues, and this was a great opportunity to go to Medicare supplement. We did the Plan F, so they don't have to worry about what their co-payments are going to be and what doctors they need to see.
Yeah.
This is a great opportunity to do that.
Good advice. I bet you have some advice for Jim, too. He's on the line right now. Jim, thank you again for watching Life Ahead. What is your question for Greg tonight, Jim?
I hopefully have an easy question for you. How can I be sure that a procedure is Medicare approved? Do I need to just trust the doctor, or do I have to go online to check at Medicare.com or some other location?
That's good. I mean, because a lot of people have that kind of situation. How do you advise Jim?
Jim, I would trust the doctor on it. I think it's one of these things where you can ask the question, is this covered by Medicare? If he's not sure, go to billing, go to find someone who can check that out for you. But that's an important question to ask, particularly if it is a, shall we say, cutting-edge technology. Those are the things you have to watch out for, because sometimes Medicare hasn't quite caught up with the new procedures that doctors are doing.
I hope that helped you, Jim, and thank you for watching tonight. I've had somebody also ask me, Greg, they wanted me to ask you, do you have to, if you're going to have surgery, like Jim mentioned, surgical procedure, and you find out that, yes, your doctor's in network, do you also have to check and make sure, like, the anesthesiologist and everybody else concerned is a provider?
That's a good idea.
Okay.
It is a good idea. And I had this particular thing happen to me last year because I had a procedure done. And I went to an in-network hospital and had an in-network provider group. All was good. And they took me to an out-of-network operating room. And I had no control over that. So I was able to fight it. But those are the things you have to watch out for. And it never hurts to ask the question before you do it.
Good advice. Thank you, Greg. Again, the time has gone so quickly. I hope we've given you some good education and information tonight about health insurance. Greg McDonald, so nice to have you with us.
Pleasure to be here, Sandy. Love to be here to do it.
Next week, we've got an interesting show coming up. Perhaps you have someone in your family or know someone with Alzheimer's or dementia. We'll have a memory care specialist here that will take your phone calls and hopefully be able to give you some good advice. Meanwhile, have a great night, and we'll see you here next Wednesday.